Hello, and welcome back to another episode of Straight Up with Steph. Okay, before I tell you about what we're talking about today and my amazing guest, I just want to tell you 3 days ago, I had a tongue tie surgery. So, if you don't know, my tongue was tethered. And so I got the piece of tissue under the tongue that attaches it to the floor in the mouth. Basically, I got that cut. And then I also got some lip ties released. All of this, I mean, there's a few reasons why I did this, but it's to hopefully help with my jaw function, tension in my face and my neck and my traps, and to help me breathe. All that being said, I'm talking a little weird today. So I'm probably the only one that notices, but it's like my tongue doesn't really know what to do anymore. And I've got this weird lisp. I even snorted earlier when I was like practicing talking. So if I sound a little different, I promise I haven't been drinking. I haven't had a stroke. I'm fine. I'm just learning how to talk again. I mentioned part of the reason that I got this tongue tie, lip tie surgery was to help with breathing. And breathing is so important when it comes to sleep. So, it's all tying together today. Sleep is so important, and I haven't respected it enough until I hit perimenopause and sleep literally walked out the door. And I turned into a little bit of a crazy person for a while when I wasn't getting sleep. So it is so important and it's so foundational to our health, to our mental health, and our longevity. I say in my lectures too, sleep is the one thing that if you have it, everything gets better. And if you don't have it, everything gets worse. And I'm sure that you would agree. Today, I wanted to dive into sleep, what happens when we don't have it, how we can get it, different treatments for things like sleep apnea, how it shows up in kids, how it shows up in women in perimenopause. So I found my expert today. Her name is Dr. Meredith. I actually found her on social media. She creates a lot of great content, by the way. I really encourage you to follow her. And she graciously agreed to spend some time with me on the podcast. She was very busy, but she made some time for us today. So whether you're in dentistry or not, if you want to learn about sleep, everything that it does for us, how we can get more of it, and how we can get better quality of sleep, this episode is for you. I hope you enjoyed today's conversation with Dr. Meredith. Hey, it's Steph, and welcome to the Straight Up With Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Dr. Meredith. I am so excited to talk with you. Welcome to the Straight Up With Steph podcast.
Thank you so much for having me.
I cannot wait to dive into all of this stuff about sleep. Sleep is something over the last couple of years I've really developed a respect and passion for. But before we get into all of that stuff, I know about you a little bit, but for those who don't, tell us a little bit about who you are and what you do.
Sure. I'm a neurologist by training, and I'm subspecialized in sleep and behavioral sleep medicine. And I have my own little practice in the Seattle, Washington area. And I also post a lot of educational content on Instagram, Sleep Dr. Mare. And I'm also a medical advisor for a tech company called Oslo Sleep.
Awesome. I love that you're in Seattle. I love Seattle. I don't get there as much as I'd like to, but I also noticed I was reading, I stalked you a little bit, I'll be honest, in preparation for this. And I saw that you're a marathon runner and a mountain climber. Like, I bet you're in the perfect area for all that stuff.
Oh, for sure. I mean, I that's one reason why I love Seattle is it's so accessible to the mountains. I think it's one of the most accessible areas. I mean, you're in Colorado, so it's also the same
Yeah.
way, but we, have the Puget Sound here too. And yeah, I love it. It really resonates with my lifestyle, but I grew up in Ohio, so I wasn't always this way. It was a passion I discovered later in life.
I have a lot of respect for you. I can sprint for small amounts, but long distance, like forget it. And I tried mountain climbing. It was, by the way, it wasn't even outside, it was in an indoor gym. And I'm relatively strong. And that was one of the hardest things that I've ever done. I did it once.
Oh, well, I mean, yeah, it's hard the first time, but it's actually really interesting how so strong climbers are, and they're very unsuspecting when you see them in street clothes. You don't know how strong their fingertips are and just how incredible. They're actually not bulky at all because they have to be so efficient.
Well, their stamina too, and just being able to like be on those tiny little holds in the feet. I remember my toes got so sore just being on these small little things. And I didn't realize how much leg strength is in climbing. I guess I was a novice and I thought it was all arms, but there's so much with the legs.
Yeah, it's really tactile. It's very sensory and balancy. I think a lot of people think about strength being a motor skill, but there's also the sensory aspects. So much coordination and balance. I love it. It makes your mind work in a way that really lets you be in the moment. And I love that aspect of it.
Oh yeah. That's one of my favorite things about working out is it's one of the times where I'm extremely present. I'm not thinking about anything else. But with those, endurance type things, obviously sleep probably is something really important, which is what you specialize in. But I guess my first question is how much sleep do we really need and why should we care so much about sleep?
Sure. Well, if we look at large populations of people, big research studies, what we can see is the healthiest people in general sleep between 7 and 9 hours. And there are obviously outliers to that and individual needs. And that's very important for someone like me who works one on one with people. I'm not doing research on populations, I'm working one on one. So, for instance, people have probably heard of like LeBron James saying he sleeps like 10 hours because here's someone who is subjected to jet lag a lot. They're very intense physical training, that kind of thing. So even though he's healthy, there's no medical reason he may have an increased demand for sleep. So I think in general, the answer is 7 to 9. And then also, we have these individual variations based on our personalized lifestyle. And then there's also some genetic variants where some people just need longer, so maybe 10 hours. And then there are also these people that genetically only need 4 or 5.
And it's not just the time we spend in bed, right? I learned a lot about sleep architecture and we have to spend time in each of these different sleep stages. So can you speak a little bit about that?
Yes. Sleep has an architecture to it. And what we mean by that is it has a structure. So if you watch people sleep and you record their brain waves like we do in the sleep lab, you'll see that they move through these sleep cycles of 4 sleep stages. So it's non-REM stage 1, 2, and 3. And then there is a REM stage. And then usually there's a brief awakening and people move through these cycles, 4 or 5, 6 times a night. And the sleep cycles, they change in their distribution over time. So at the beginning of the night, you see more of that deep non-REM 3 sleep, or N3 we call it. Slow wave sleep is another term that we use. And then towards the end of the night, it's higher in REM sleep.
Okay. And so I guess I'll just share with you, I started really caring about sleep and learning more about it when I hit perimenopause because
Oh
sleep
yeah.
just walked out the door. And I was like, what the hell?
Mm-hmm.
And when I was learning about the different sleep stages, it seemed to me that like deep sleep, correct me if I'm wrong, but I was looking at it like deep sleep, that first part of the night was more restorative for like muscles and stuff like that. And then as
Mm-hmm.
we progress through the night, we get more into REM sleep, and that's more for mental health. And I was like, well, maybe because I was waking up at like 2 a.m. every morning and I was getting my REM sleep cut off. And then I felt like a crazy lady the next day. Like, am I on the right track with that?
I think, well, what you're saying is true about non-REM sleep and REM sleep. Those are generally our understandings of the functions of those stages. But I think it's important to see them as a whole. So, an
Yeah.
analogy I might make is that it's important to do cardio and strength training, and it's important to do zone 2 and more VO2 max or hit workouts. And so it's not really like one is better, because I think there's a lot of focus on people saying, oh, I need deep sleep, or why aren't my deep stages this percentage? But it's that architecture that's really important. And so sometimes people do notice changes with perimenopause, for instance, or other reasons. And what they experience isn't necessarily like a direct correlate to, you know, I didn't get enough REM sleep. So that may or may not be true. It's hard to say from your description, but it certainly could be. It could also just be because your total sleep time, when you add it all together, or the continuity of your sleep in general, was the sleep architecture was disturbed.
Yeah, it gave me a whole another level of respect for sleep because if I don't get the sleep that I need for my body, I mean, I'm a different Stephanie the next day, and it's usually not a good one.
Oh yeah, I think most people can relate to that, and I think we notice it more as we get older because it's harder to compensate for those changes as we get older. I
Yeah.
think just our lives are more demanding, and I also think that we're less resilient to those things.
I know that resilience, that's something that's on my mind a lot. I feel like getting older is almost this progressive narrowing of things that you can get away with. And there's really just not much, you have to be pretty on point with things.
I think that's true. I think that's a great
Yeah.
observation. Yeah.
Yeah, it's just, yeah, I definitely feel it. So, with that, what I just said about waking up at 2 or 3 a.m., I hear that this is common with some people, especially women in perimenopause. So, do you have any tips for if someone does wake up in the middle of the night, how they can get back to sleep?
Sure. There's a whole field called behavioral sleep medicine where chronic insomnia is one of the very large components of that field, and treating it with a state of the art behavioral treatment called cognitive behavioral therapy for insomnia.
Hmm.
But I think something that's really important to point out and that it's often missed is that just because you have trouble waking up in the middle of the night, can't fall back to sleep, doesn't mean it's chronic insomnia. It could also be due to vasomotor symptoms of perimenopause, so hot flashes, thermoregulation issues. It could also be due to obstructive sleep apnea, which is a breathing disorder during sleep. And women have a huge surge in being affected by sleep disorder breathing when that hormonal change occurs.
Hmm.
So I think it's important to try to understand what the cause of the awakening is first and not just assume it's insomnia. And the way that when people have the experience of insomnia, one thing that often happens is it's kind of like almost like this mini trauma or this bad experience where once it happens to you, and then, like you said, you feel so horrible the next day, you almost brace yourself to expect it. Or if you had this brief awakening that otherwise would have been something you really didn't pay that much attention to and you just fell back to sleep, now when it happens, there's kind of a performance anxiety that comes up for
Hmm.
people. Oh no, it's happening again. And so that's really where this cognitive behavioral therapy focuses, is helping people recognize that pattern. And that's why, every magazine article, every self-help thing says like get out of bed, is because we're trying to sort of avoid that like kind of pressure on the performance anxiety to force sleep to come. So there's a lot of little tactics around that, like behavioral tactics we can talk about that work for different people, but a little bit of it depends on, what the cause is. And I would say a huge trigger for people can also be sort of more than one thing converging. So it could be perimenopause, but also my life is more stressful and complicated than it's ever been because now I have kids, I have aging parents, my house, whatever roof is leaking, I have the stressful job. It's like all the things, right?
So there isn't necessarily like a one size fits all hack that you can just say because we need to know what is causing it and it's different for everyone.
I would say so. If it becomes, a major problem to where the person feels really impaired by it, it's really affecting their life, they're taking sleep aids. If it happens one time, most of the time people just, they recover from it and they go about their business. But if it does become this pattern, that's really when people will say it's a problem. And at that point, yeah, you really, I think, need to, I mean, you can do any number of these hacks that we see online, and a lot of them are there's some kind of distraction technique that's some variation of counting sheep, right?
Hmm.
So basically, instead of, the brain really can't multitask. That's a myth. It can only focus on one thing at a time. So if my mind is racing and thinking I can't fall asleep, this is so frustrating, but I give it a task, counting sheep, doing this like eye movement trick that's online, or, saying something for every letter of the alphabet. There's like different variations, doing a breathing exercise. Then my brain really can't think about the fact that I'm not sleeping. So those are
Okay.
really common ones, is to like use some kind of distraction. Some people will listen to audio tools. Some people might listen to a sleep story. I don't know if you've heard of like, the sleep podcasts or sleep stories.
Yep.
Those have become very popular, I think. So, and you have to find
When
what
I
works for you, right?
Okay, yeah, but bottom line is probably not good to sit there and stew on the fact that you're not sleeping. That's exactly what I did. I'm like, oh my God, I kept checking the time, thinking about my to-do list for the next day, worried that I wasn't going to be able to perform, and it was just like this whole, and then the next night was the same thing. It's like I created this self-perpetuating cycle and it's miserable to be there.
Yeah, you create a scenario that because we're really smart and adaptive people, we come to expect it to happen again, especially when it's something negative. So if you think about something negative that happens, like you got in a car accident at this spot, you went to this restaurant and you got food poisoning, there's this person that's always nasty to you every time you interact with them, then you sort of expect it when you see that coming. So if you have a bad experience with sleep, over and over, then you start to expect, oh, when I go to sleep, it's going to be a rough night. As soon as something starts to happen, I'm going to assume worst case scenario. So, like, there are classic things that people with chronic insomnia say. So they'll say, oh, I was so drowsy on the couch. I was so sleepy. But the minute I went to get in bed, I was wide awake because their body is, involuntarily recognizing that this is a stressful place. This is a
Mm.
place where I ruminate and there's stressful things that happen. So that's why it's so important. If you get into that pattern, it's so important to leave, even though every single person, when I tell them that, says, why would I leave? Because if I get out of bed, I know I'm not going to fall back to sleep, right? But what you're trying to do is you're trying to let that sort of storm and that, tendency to want to force it, you want to remove yourself and like kind of let it pass. And then when you feel sleepy again, come back.
Okay, so I wanted to ask you too about, because I know some people wake up in the middle of the night, but then some people have a really hard time just falling asleep. So is that your advice for them, is to, if they're laying there, just to get up and then go back when they're tired again?
Most of the time, yes, it
Okay.
is. Because I think that's one of the biggest problems when people have trouble sleeping is, I mean, everything in life that we do almost, if you try harder, put more effort into it, work at it, you get results, right? Sleep is the complete opposite.
Mm.
And there's also a timing issue. So there's a circadian rhythm. And I think also sometimes people are just trying to sleep out of sync with their circadian rhythm. And so we try to think about getting those things lined up. Like I tell people, think of sleep like surfing, and you may never have been surfing before, but you can understand that you don't paddle out. You don't paddle before the wave comes. You wait till you feel it and then you paddle. Otherwise, you're just spending a lot of energy for nothing, and you have to wait for the wave to come. So we'll tell people who have trouble falling asleep, wait until sleepiness comes, wait until you feel that urge to pull you, and then go get in bed. And it sort of retrains the brain instead of saying, oh, this is going to be a battle tonight. Oh, what's going to happen tonight? Is this going to be good or bad? And it says, setting myself up for success.
Yeah, I really like that analogy of the wave. That makes sense to me.
Yeah.
Something you posted about recently, I think in the last couple days, was sleep trackers, and I wanted to get your opinion on that. I learned a lot. I
Mm-hmm.
used one. I don't anymore because I was getting a little obsessive and like fixated on it. It really taught me about sleep cycles, my sleep cycles, and like what habits helped and hurt my sleep. But honestly, it turned into this, like, I would check it first thing in the morning. It was a whoop. I would look at it, and no matter how I felt, if it said a certain thing on my readout, that's how I set myself up for that day. So if I had a bad
Mm-hmm.
score, I was like, this is going to be a shit day. And then I was like, okay, this isn't helping me anymore. But anyway, what's your opinion on sleep trackers?
I am so excited about the potential that they offer us. And I know I
Mhm.
mentioned that I consult for a tech company called Oslo Sleep, and they're a sleep technology company. They make a product called Sleep Buds, but they also have sound masking technology, soundscapes, and they also have a sleep tracking feature. And the thing is we're just not there yet. And I think that's one of the reasons I wanted to work with this company is, and they wanted to work with someone like me that works with people in the clinic every day, is how do we help people in the way that you saw was beneficial? Like, tell me what you noticed, but people will typically notice that alcohol is really bad and it helps them not drink as much.
Mm.
Or I don't know, were there other things that you noticed? I'm just curious.
Well, so I'm not a drinker. I haven't drank for a
Okay.
while, but I can only imagine what it would look like. But for me, it really trained me to stop eating 3 to 4 hours before I went to sleep.
Oh
Because
yeah.
anytime I ate within that window, my sleep was just jacked. and
Yeah.
like making sure that I'm not, getting up too early or things like that. It just really helped train me.
Yeah. So that's great. I love that. That makes me feel so excited, and giving people tools where they can take action in, because there's such a shortage of sleep medicine practitioners.
Oh, is
But on
there?
the other
Okay.
hand, yeah, they're like, the ratio is one to something like 43,000 people. There's one sleep doctor for every 43,000. And
Yikes.
there's only like 200 some behavioral sleep medicine practitioners in the world.
Oh my
But
gosh.
the problem is what you said, which is that, how we feel every day is multifactorial. It doesn't just have to do with our sleep. And I think some
Mhm.
people really don't recognize that, because I always tell people, think about, like, I'll give you an example. I remember the night before I got married, I didn't sleep at all. I was awake all night, and it wasn't bad in any way. And the next day when I got married, it was like one of the happiest days of my life, right? So the context of it really matters. But when you kind of outsource your ability to understand how you feel, and you just say, I'm going to attribute everything to the score, and then there's sort of this self-fulfilling prophecy, and especially if the score is bad,
Mhm.
that's harmful to people, right? And so people focus too much on the score, I think, and people focus on their percentage of deep sleep. And I think the other problem is the sleep trackers don't quite have the ability to really stage as accurately. And so that's one of the criticisms I would give of them. And also wanting to educate people on how to use them, to get the most out of them. So I do think they'll improve. And for that reason, I'm really excited. But I also would love to see more of the trackers being interested in working with people that actually work with patients, to integrate it into clinical care, because that is a very powerful tool for behavioral sleep medicine. It also saves a lot of time for us if we can have that information. But, I don't know if you ever had the inclination to ask your doctor to look at the Whoop, but when someone asked me to look, there's really not a good way for me to look at that data. I mean, you can take a screenshot, but it's kind of hard. So I think those are the things that I'm excited about, but I feel like we just aren't there yet.
Yeah, well, I'm sure it's just gonna get better and better, and I did mention it to my doctor, and he had no idea what a Whoop was, so I was like, "Okay,
Yeah,
never mind."
see,
But I used it, like, I definitely found it useful, but I got to a point where I felt like I had gotten what I needed out of it, and it was just
mm-hmm.
starting to mess with my head, so I was like, "Ah, I might pick it up again." But tell me a little bit about the buds. What is that? Is that something you put in your ear?
Yes, I wish I had them here with me in reach, but so they are very unique technology in that they're a wearable and a nearable. So they come in this little pod case that also has environmental sensors, so it can sense light, temperature, humidity, and sound. So one thing people don't realize, but environmental sound is a social determinant of health, and it's also a social disparity. So if you think about living in like New York City, there's cars, there's traffic, there's garbage trucks, there's neighbors, there's all kinds of things, there's airplanes, and those things can be very disruptive to sleep.
Mhm.
There's also, my bed partner is snoring, and we know that if your bed partner snores, you're 50% more likely to be diagnosed with chronic insomnia, because they're waking you up, right?
Mm.
So these sleep buds, the company came from Bose, if you know that company.
Oh,
They
yeah.
sort of they got the IP from Bose, and they started this company, but they're meant to be comfortable for sleeping in. So I don't know if you've ever tried to sleep with an AirPod in, but it'll like, the battery will die, it'll wake you up, and it's like not that comfortable. So they're meant to be comfortable. And then they have all this really cool technology to mask sounds, to mask environmental sounds, and then also provide soundscapes. So anything that someone finds relaxing, or anything that someone finds pleasant, that's going to help them relieve stress. So one of the components of CBTI is actually relaxation. And there's this interesting trend happening that a lot of people are sleeping with listening to audio, like falling asleep listening to some kind of audio content, which, if you
Mm.
think about it, is better than being on your phone, right? And so the sleep buds, you don't actually have to have your phone. The sounds are stored in the buds. So yeah, and then like I said, there's a sleep tracking feature called sleep patterns that is in beta, and we're working on developing. So I'm really excited about that. And it also has, for people who have tinnitus or ringing in the ear, it also is beneficial for people dealing with that.
Oh, wow. I hadn't heard of that. So I'm going to have to check that out and see. I love that you don't have to have your phone right there because that's something that it's like it's there because I need it, but it's not, I don't like having it right next to me when I'm sleeping.
Oh, I know. Because even just knowing it's there,
I
there's an
know.
urge. It's like it calls to you, right? It's like a
Yeah.
siren song.
I
Yeah.
have it like all the way on the furthest part of my nightstand face down, but it's like I still know it's there. So, speaking of phones, what are like three things that we should absolutely not do right before we go to sleep if we want good sleep?
Well, being on your phone or being on a device is one,
Hmm.
and especially not doing work, not checking your email. I love it that you talked about not eating, because I think that's something people really underestimate, not only because it disturbs your sleep, it diminishes your sleep quality. There's acid reflux. But when you eat at night, those calories, they're heavier calories than if you ate them early in the day. Your body just metabolizes them against you a little bit. So, especially if you're trying to maintain a healthy weight or even take off a little weight, that's just so counterproductive. I think if you struggle at all with falling asleep, you also want to have that 3 hour window for working out. I think that it sort of delays that temperature regulatory process that facilitates sleep. So those are the three things I would probably say the most: is getting off electronics, avoiding eating, and then the physical activity or exercise.
Yeah, I too, like I mentioned, I haven't drank in a long time, but I know that alcohol is tricky and some people do use it as a sleep aid. And I talk a little bit about, I lecture a lot and I talk a little bit about it in my lectures, nothing like I'm sure what you do, but it's like, yeah, maybe it'll help you fall asleep, but it completely destroys your sleep architecture and your REM sleep, and then you wake up with this anxiety. And from what I've learned, the same thing is with THC.
Oh, I was just going to say that. And I was so interested to hear your experience, because I think Washington State and Colorado were the two first states that legalized
Yeah.
it. And I don't know if you're seeing the same thing, but I'm seeing people, especially younger people, that they're so good. They're not drinking the alcohol. They're not doing like the mommy wine culture, but they are doing the THC gummies or the CBD gummies. And it's exactly the same thing. It's like, it makes me feel like I slept better, but if you actually look at the objective measures, it's not true. And then like long term, it's very harmful.
Yeah, and it just kind of ruins your own body's ability to like regulate and to sleep on its own, right? And then you're dependent on this thing that really isn't even helping anyway.
Yeah, yeah, totally.
Yeah.
So, yeah, do you see that in Colorado, like people moving more towards marijuana products than alcohol? Or
Yeah, it's interesting. So when I don't see patients as much as I used to, but when I do, usually I'm doing the oral cancer screening and I'm asking them about substances. And I do hear more and more people are like, oh no, I don't drink, but I use marijuana to help me sleep. And I'm like, okay. And then we have a little conversation about that. But I'm curious, like, are they paying attention to how they're actually feeling the next day? Maybe it's helping them fall asleep and tricking them into think they're sleeping, but how are you actually feeling the next day? Do you feel good or not?
oh, that's a great, yeah, I love that. It's important. And I think I don't know how it is in Colorado, but it's marketed as more of a wellness product. It's marketed adjacent to supplements. It's plant based. So it
Yeah.
seems less offensive than alcohol, right?
Yeah.
But I don't
It's
know. I
tricky.
think it's just as bad.
Yeah, and for some it can't, I mean, it's got cardiovascular issues, like it can, depending on the person, it cannot be all it's cracked up to be. So, I wanted to ask you about sleep apnea. Me in dentistry, I'm very interested in this. We're being trained more and more to screen for airway issues with patients, but how common is sleep apnea?
It's extremely common. It's more common as you get older. I think the percentages are all over the place depending on, which studies you look at, but certainly increasing over time as obesity has increased. And for women, like I said, we have a lower risk until we get into the perimenopause, menopause transition. I love it that dentistry has taken this mission on, because people see their dentist more than they see their primary care doctor, right? I hopefully see them twice a year, and they've a lot of times had their dentist forever, and they're a very trusted person. And as you know, there's a lot of skepticism in this area. I think, especially in children where it's more preventative. And unfortunately, I think a lot of the pediatricians are kind of like a watch and wait, they'll grow out of
Mhm.
it type of thing. I don't know if you've come across that. I come across that
Yeah.
here. But I just think the opportunity for screening and the trust in the dental field, they, having that access to trust with their patients, I'm so excited about it. And it's a huge part of my practice here. It's a huge part of the training I received at Stanford. I was a little dismayed from an article I saw. I don't know if you saw that article in the New York Times recently where I forget what the title was, but it was something that made it seem like kids were being overly treated with expansion, palate expansion.
Oh my gosh,
Um,
I did. I didn't like dive into it, but I did see it. Yeah.
yeah, did you see that?
Yeah.
And, but, I did my training almost 20 years ago now at Stanford. And one of my mentors there, Christian Guimeno, who was a huge, huge advocate for screening children and intervening with the airway really early, even 20 years ago. And it's a little bit dismaying to see that 20 years later, those sentiments are still, it's still very misunderstood. I have wonderful orthodontists here, Becca Bachau, up in Seattle. I don't know if you know her, but
Mhm.
we work together really closely. And then it's so gratifying to be able to intervene with kids really early. I love that.
Well, I just feel for people who are listening that don't know, like I just feel it's such a huge opportunity to treat kids because things move so much quicker, right? As an adult with expansion, like my dentist wants me to do that and I'm just like I'm not sure if I'm going to do that. It's so
Yeah.
easy with kids, but also, if kids have sleep disordered breathing and they're not sleeping, that's when we see things like ADHD, right? And learning issues and like what other problems with kids can we see because of this like lack of sleep essentially?
The one I always tell parents is mental health conditions. So,
Mhm.
and I use myself as an example that I'm someone who didn't get diagnosed with sleep apnea until I was in my sleep fellowship. So I was in my early 30s. But if you look back at me, my whole life, you can see it. I had very bad allergies as a child. I had adenotonsillar hypertrophy, so I was a mouth breather. Because of that, I had, maxillary deficiency, I had a crossbite. I didn't get orthodontics till I was 10. And luckily, the orthodontist did not pull my premolars to make space, but told my parents we can make this puzzle piece fit together, but there's she's going to have basically need gum grafts when she's like 18 or 19 because and then deal with gum recession, which is true. So that was me. And then I made it all through my medical school, my medical training. I'm doing fine in life, right? But the difference between how I felt between getting my sleep apnea treatment, getting, well, upper airway resistance for me, getting sleep disorder breathing treated versus not is night and day for me. And that's the tricky thing is this is an invisible illness, right? To some degree. But feeling sleepy, wanting to take a nap, having a hard time getting out of bed in the morning, having kind of like, muscle tension and your could be your jaw, could be your neck, things that I had, headaches, having the mental clarity and, the attention, the concentration, the not irritable. That was a life-changing event for me to recognize that and get it treated. So,
That's
yeah.
amazing. And I remember I took a dental course long time, like over 10 years ago. And I was just starting to learn about, sleep apnea and stuff. And the guy was like, this isn't for our 80-year-old fat men. This is for, he would call it young, fit females. And I'm like, I'm a young, fit female. Like, do I have sleep apnea? And he was just saying, it's not this what we think it is. And it's so much more pervasive than we think it is, too.
Yeah, it's really a spectrum. And there is a degenerative process to obstructive sleep apnea and sleep disordered breathing, meaning it sort of progresses. And
Hmm.
when you get into that late stage, it's so much harder to treat it. And so, one of the reasons I feel so passionate about it is because as a neurologist, I took care of people who had strokes and Alzheimer's disease and other types of dementia. And what those people ask you when that happens to them is they say, why did this happen to me? And how can I prevent it from happening again? And a lot of times there's a history of some kind of risk factor, and sleep apnea is very common, so if you can fast forward to the future and go, if I take care of this, I can avoid or delay something like that, it would be worth it to me. But it's harder to see that when you sort of feel like you're doing fine in life. It's hard to sort of see how it might enhance. So that's part of what I consider my job to be, is to get people to notice these things, that they are symptomatic, and then say, hey, well, what if you just tried the treatment, and what if we just saw how much better you felt? Would it be worth it to you?
I just think of when I was
You're fine.
practicing full time and I would have airway conversations with my patients. And honestly, sometimes they would look at me like I had two heads or like not want to
Yeah.
talk to me because they didn't think it was my business. Hopefully that's changing. But I would remember I would ask them certain questions because they clearly had an airway issue, right? Like I could tell just by looking at them. And I would ask them questions as far as like daytime sleepiness or difficulty focusing or whatever. And they're like, no, I'm fine. And it's like, you clearly have sleep apnea. Like you just have the look. So is
Hmm.
there like a checklist that you or some kind of self quiz that people can ask themselves as far as maybe there is some issue, even if they don't know?
Yes. Well, the one that I use in my clinic is called the Stop Bang questionnaire. The
Hmm.
problem with it, and it focuses more on snoring, feeling tired, apneas, your neck circumference, your body mass index, if you're a man. The problem with that is it's really not meant to pick up, the women and the thinner
Hmm.
people. And because the research initially in sleep apnea was really done in white men. So for women, we want to think about fatigue, morning headaches, insomnia. Those are the most common symptoms in women. But those are validated screening questionnaires where if you answer yes to two of those questions or three of those questions, then you have a very high probability of having some degree of sleep apnea. We also know just based on age that it increases. And so the way I think of it as a neurologist is it's no different than having high blood pressure or high cholesterol. It's something we just want to screen for at some point, right? I mean, maybe someday when people turn 50 or when women go through perimenopause, we'll just screen them because we know that's an important stage to start preventing or starting to recognize.
So for screening, is the gold standard still a sleep study like in the office or what has that changed?
Mostly because of insurance requirements, we're mostly doing home sleep testing now. And the home sleep
Okay.
testing has, in my opinion, gotten better and better, but it still has a higher false negative rate than the in lab testing. So our usual protocol is to do home testing. If there's still a high suspicion, then do the in lab testing. And, but to start with some kind of clinical evaluation that goes beyond an airway evaluation, but more is asking questions because if someone says they're tired, but they're only getting 6 hours of sleep, then you've got to look at, a bigger picture, right? If
Yeah.
someone has insomnia and they're tired, or you want to look at more of a bigger picture. So I think that's the tricky thing is, trying to figure out what are the different sleep problems, because there's usually not just one, there's usually a combination, and then trying to sort of prioritize and help the person work through each one.
Yeah, and I mean, it's never simple, right? Like, there's never a simple answer
Yeah.
to any of this. It's always like a process.
Yeah.
So, as
I
far
would
as
agree with that.
treatment for sleep apnea, like, is CPAP still the number one thing? Are there new things? Because I'm not going to lie, CPAP, I want to get screened for sleep apnea, but if I have to wear a CPAP, I mean, I'll do it because I'm into health, but I mean, it's not the sexiest thing, right? To use at night. So, is there anything else that's like just as good?
Well, I'm curious to ask you, I mean, obviously it's not sexy, but is it more than that, or is it really just the idea of having to wear that seems so unappealing that makes you
Yeah,
feel
it's just like when I go to sleep, I have a very set, like I have my eye mask, I put my earplugs in, like I have this, like I'm used to feeling a certain way that helps me go to sleep. And I just imagine if I have to wear a freaking mask on me that's making noise, like I don't know how that's going to go.
right?
But I want to live a long time and I want to be healthy. So it's like I
Yeah.
would do it, but I would probably want to know if there's something else that would work just as good.
Yeah, there are things that work too. CPAP is still our gold standard. And one
Hmm.
of the reasons why is it is very effective, but there's also a practical reason, which is that insurance covers it. And that's
Oh,
one of the first questions that comes up when I'm talking to people about their diagnosis of sleep apnea is, well, is the dental device covered by insurance? Is an orthodontic treatment covered by insurance? Is a surgery covered by insurance? Is a weight loss medication like Zepbound covered by insurance? And so people want to know that right off the bat. And I can
Mhm.
tell them what I can tell you about CPAP is it's tried and true. It's covered by insurance. I can prescribe it to you and you can start using it usually within a week. That's really nice. There's a lot of nice things about that. However, if you do feel like it's unsexy, I want to go with something else, then we do have these. I'm sure you're familiar with them, but they're retainers that brace the lower jaw slightly forward. And what we're doing is we're trying to move the tongue out of the airway.
Mhm.
So it's basically an oral appliance that you wear while you're sleeping. So that's another option. Works better if you're thin, works better if your sleep apnea is mild or positional, and is considered a first line treatment. Now, it's interesting to see because some dentists really like it. Some dentists go, I would never wear that because I know I'm going to have problems later with shifting of my bite. So you could probably speak to that better than I can, but we know that over time there are these side effects. We were talking earlier that there are these airway orthodontic treatments which are more of a hybrid between an orthodontic treatment and a minor oral surgery. So we're talking about MARPs, so mini screw assisted rapid palate expansion, where there's a bone borne palate expander surgically implanted into the roof of the person's mouth. We're turning it over the course of, 6 to 12 months to create a wider palate, more room for the tongue to sit in the roof of the mouth, widening the floor of the nose, getting a better nasal airway as well. But there are also variations of that. There's something called a dome procedure. There's something called an ease procedure. We also have the maxillomandibular advancement surgery. But basically, we're moving the jawbones to create more space in the airway. Very, very dynamic treatments. But I think perceived as very invasive by people, by patients, and sometimes not covered by insurance and very expensive. And then we have the ear, nose, and throat doctor who can remove tonsils, palatine tonsils, lingual tonsils. They can trim the uvula and fold it up. They have a hypoglossal nerve stimulator surgery where they put a nerve stimulator into the nerve that controls the tongue. They also have a whole host of other surgeries to do with the nose, and I won't kind of go into those today,
That's
but
so much.
there's a lot. And then the exciting thing is that Zepbound or tirzepatide, which is a GLP-1 GIP drug, which is in the same family as Ozempic or Wegovy, if people have heard of it, got FDA approved for sleep apnea in 2024 for people who are overweight. And it's working not just because of weight loss, but by other mechanisms. And that has
That's what I was
been
gonna ask. Is it just because it's
extreme.
helping him drop weight?
No, the AHIs, so the apnea hypopnea index, or the number that characterizes the severity of the sleep apnea, is decreasing more than we would expect just from the weight loss.
Hmm.
So decreasing inflammation, improving metabolic markers, because OSA is a metabolic disease, right? It makes you more insulin resistant. It makes you gain weight potentially because you're eating carbs and you're craving foods. And then other ways we don't maybe understand, other
That's
mechanisms we
really
don't maybe understand.
so with the GLP-1s, like let's say someone is using it to help them with sleep, does that mean that they have to be on it forever? Like what happens when they come off? Is their sleep apnea just going to come back?
Probably because we know that when people they come off, they usually gain the weight back.
Yeah.
Because I mean, people lose weight, but they also eat healthier. I think, and people will say other things like they drink less alcohol, they, you know, feel better during the day. I don't know if you've heard people saying this, but it changes the behavior beyond, I think, just losing weight.
Hmm.
There's other aspects of it.
Yeah, I'm really interested in GLP-1s, both the good and the bad. I'm actually going to be doing a podcast episode in a couple months about that, just to get into all the nitty-gritty. Because I mean, I feel like everyone's, not everyone, but a lot of people are on them, right? Whether they know
Yeah.
everything about them or not.
It is the single greatest advancement in medicine that I've seen in my career.
Hmm. Wow, that's a bold statement.
It is. I mean, I think it's pretty undeniable. Like for those of us who've been prescribing it and seeing And that doesn't mean there's not a downside. That doesn't mean that people aren't using it the wrong
Yeah.
way and to like the point of an unhealthy weight loss. And, but yeah,
Yeah.
I saw this,
Yeah.
I saw this graph of where you can see how obesity is like going up and up and up and up throughout time in the US. And when those medications came out was the first time in like, I don't know how long that it went down.
Oh, it went
Yeah.
down. Didn't just
It,
plateau, but it went down.
yeah, it went down. And I mean, as you know, obesity is a huge, huge problem for society in terms of risk for cardiovascular health, for stroke, for diabetes, you name it, right?
I
Sleep
know it's such a
apnea.
burden on our healthcare system too. So I know I can't believe we're already like coming up on time, but I did want to ask you about sleeping pills. Yes or no? Are there any like downsides with those? And are there any supplements that you recommend?
So with sleeping pills, I would say mostly no.
Okay.
And if so, temporary. But even then, I don't love it simply because if we reflect back on what you and I were talking about with cannabis,
Hmm.
you can feel like a sleeping pill really helps you, but objectively, it really isn't. And that's kind of what we know is true. And there's been some really interesting studies coming out showing that even things like Benadryl, that seems very harmless, is affecting your brain health. And if you think about it, it kind of makes sense. Like when you take it, you feel so foggy in the morning.
Yeah.
Same thing with Ambien. It could be interfering with the brain cleansing system. Things. Same thing with trazodone, which is the number one sleeping pill prescribed in the U.S. And with supplements, I would say hands down, it's the most useful sleep supplement, but it is almost never used correctly. It's not regulated by the FDA. So what people are getting in their commercial product is probably not as advertised. So, using supplements, really important to buy products that are independently tested.
It's the right
Magnesium,
way to use melatonin. Like, is there a dosage?
yeah. So a lot of people think of melatonin as a sleeping pill, and it's not. It's actually a hormone signaling to the brain that it's nighttime. It's a signal of darkness. So our natural melatonin secretion occurs when the sun goes down,
Mm,
except for the fact that now we have artificial light, so that
yeah.
that whole pathway has been suppressed. So that makes it kind of useful in a way, right? Because you can sort of mimic it, and that's why sleep masks are really helpful, especially up here in Seattle. It's light out till 10:30 in the summer, so we need
Yeah.
kind of all the help we can get. But so melatonin is essentially a time signaler. And so one useful way we use it is for night owls to try to shift their circadian rhythm a little earlier, to kind of time them a little earlier. We also use it in autism spectrum disorder. It's very helpful. There's a couple sleep disorders. One is called REM behavior disorder, where it can be very useful at high doses. But and then the other use is in older people with chronic insomnia. There's a prescription drug in Europe called Circadin, which is a sustained release melatonin. There is some age related decline in the production of melatonin from the pineal gland. So I think that's another reason I would recommend it. But so for the timing, it's a zero point 0.5 milligram at a specific time in relation to the person's natural sleep onset. For an age related chronic insomnia, it's more of a 3 milligram sustained release, closer to bedtime. So the way you use it really makes a difference. And I think, unfortunately, people are using poor quality products with a more is better type of mentality. And I saw a statistic recently that said something like 6% of preschoolers take melatonin. And so if you just
It,
think about behaviorally, the habit of starting to take sleeping pills as a preschooler, it's just, and often disguised as candy. There's something wrong with that in my mind. That's my opinion.
yeah, I read, and I don't know where I read it, or maybe I heard it on a podcast. I don't know, but it was a sleep expert, and they were like, melatonin, yeah, maybe for adults, but for kids, it's especially concerning. And like he mentioned what you said, that a lot of parents are using it just every day with their kids, and it's not good.
Hmm. Yeah, sleep is a behavioral state.
Yeah.
It's kind of like eating, where there's a healthy way, there's a social cultural context, and we want to teach healthy behaviors around that from an early age, we don't want to treat or we don't want to teach, take something, right?
Right. I know. Cause in their whole life, they're going to have an issue and then they're just going to look for something to take. Right.
Yeah. No, and I see that happens, and people tell me that story.
Hmm. It's crazy too. Like thinking about, you talked about all of these treatments for sleep apnea, the surgery, the CPAP, the mouthpiece, whatever. We could prevent most of that by treating these kids, right? With like expanders or getting their airway opened up. So I can see why you're so passionate about that.
I'm so passionate about it. And the, I'm my 7-year-old is finishing an expansion now, and it's wonderful to see the results, but it's also so, I mean, it's so low risk. Like it's so easy to do, right?
Yeah, and I remember when I was full-time in dentistry, because I actually worked it was a dental practice, but also ortho was in the house too. And so I saw a lot of kids going through ortho, and the parents would be like, "Oh, the orthodontist talked to us about expansion, and that seems so like archaic or like brutal or whatever." And I'm like, "What about pulling all of these teeth like what we
I
used to do,
know.
closing up the airway, and then look at them as adults. Like they
I
can't
know.
breathe. They've got these tiny little mouths that like barely open." Which is worse. It's actually pretty like not that invasive.
Yeah, and I feel like it's getting worse with all of the pouches and purees and the our
Mm.
processed food, and I feel like the airways are just getting worse. I don't know if not an objective thing, but it's just kind of, I feel like so many. You don't often see kids that don't need ortho anymore, I think is what I'm trying to say.
Right. No, super crowded, not room for the tongue. And I agree. I remember reading this book that was talking about, it's like a famous book on
Is it
breathing.
breath?
And yes,
Yeah.
I'm blanking,
Mhm.
but just talking about how important it is to chew food. And
Mhm.
like what you said, all these soft things that we're eating, the smoothies and stuff. I try to keep that in mind and like try to make sure at least one meal a day I'm actually having to really chew it because I like smoothies. They're convenient, but I don't want to end up with like, a collapsed bite because of it.
Yeah, and plus we're all rushing through our meals, and we
Yeah.
don't, even if we are eating something that we could chew, we're like just, you know.
Yeah. And then we wonder why our stomach hurts, right? We're
Right.
like not actually chewing it. Yeah. So before we close out, I'd love it for you to just let people know how they can learn from you, connect with you. What's the best place for that?
I share most educational content on Instagram at Sleep Dr.
Mhm.
Mare. I'm at the same handle a little bit on TikTok. My website is www.soundsleepguru.com. A lot of my podcast appearances and media appearances are there on my website.
Okay, awesome. I'll make sure to link all of that down in the show notes to make it easy for people. And on your website, I mean, we just today barely scratched the surface of everything that you talk about. There's so many different aspects. So, a lot of resources there. I encourage people to check you out.
Thank you so much.
Yes, thank you very much for your time. I know you're a busy lady. You've got a patient here in a few minutes, so I will let you go. But thank you again. And thank you, everyone, for listening. We will see you next time.
Bye.
Thank you for tuning into this episode of Straight Up with Steph and being interested in living better. What many listeners do is subscribe to the podcast because that allows them to automatically get the latest episodes of the show. Remember, you are the best person to take care of you, and by learning what we talk about on this show, you're taking one more step to being a healthier and happier you. I'll talk to you soon.